Kaiser Permanente got another black eye from Cal OSHA today with their 12th set of violations and fines in the span of just a year. KTVU's Tom Vakar is here now and tells us which hospital was targeted this time, Tom, and what it says about the overall performance of Kaiser.
Says they got some work to do. You know, if you have more customers than others, you're obviously likely to get more complaints. But if you have more resources, way more resources, you're able to do something about it. Kaiser Permanente's Walnut Creek Medical Center is now the 12th of its California medical facilities to get fined by Cal OSHA, the Worker Safety Enforcement Agency, for violating COVID rules. In this case, the hospital was assessed $45,000 in fines based on 4 serious violations, serious defined as violations that could result in worker injury or death.
We still have issues.
Registered nurse Joe Leon has been in Kaiser Walnut Creek's COVID unit since the pandemic began.
Without staffing and the support we need, we can't give the quality care and deliver the safety that the patients are entitled to, as well as the staff.
Last March, nurses rallied at several Kaiser facilities over lack of enough personal protective equipment and accused management of keeping masks locked up while not properly sequestering possible coronavirus patients.
We survived Ebola, we survived H1N1, swine flu, but this is different.
In all, Kaiser California medical facilities have racked up 51 violations, 29 of them, well more than half, for serious infractions. Before fining Walnut Creek, also fined Kaiser Permanente hospitals in Antioch, Oakland, Redwood City, San Francisco, San Jose, San Leandro, Santa Clara, Santa Rosa, as well as 3 Southern California facilities. Even though fines are extremely limited by state law, the violations have now raised Kaiser Permanente's fines to $500,000, far exceeding other hospital groups.
It just validates what we've all been fighting for since the beginning of the pandemic, and we all felt that we weren't being listened to.
Do worker safety violations affect patient safety?
It definitely does. It can impact in many ways, and part of it is in the care that we give.
So what's the counterbalance? Well, Kaiser says most of the complaints go back to the early days of the pandemic. And of course, its sheer enormity as one of the nation's largest nonprofit healthcare organizations may also help explain why it has so many violations. And Kaiser consistently ranks high in care and patient satisfaction ratings, but all of that's put at risk with this unending chain of complaints from the state. Tom Vakar, KTVU, Fox 2 News.
All right, Tom, thank you.